Adult orthodontics has gained prominence due to the increasing demand among patients over 18 years of age, who present specific challenges such as mature bone structures, missing teeth, periodontal history, and prosthetic restorations. Their main motivation is to improve oral aesthetics and functionality, which requires individualized treatments coordinated with other dental specialties. From a clinical and biomechanical perspective, the absence of bone growth makes it necessary to respect biological limits, using light and controlled forces to avoid root resorption or periodontal complications. Complex anchorage systems are used, such as micro screws or temporary devices, and in certain cases, a combination with surgical procedures is necessary, such as orthognathic surgery, especially in cases of severe skeletal discrepancies. Treatment follows an interdisciplinary approach, where collaboration among orthodontists, periodontists, prosthodontists, and oral surgeons makes it possible to achieve aesthetic, functional, and stable results. Adult orthodontics not only aligns the teeth, but also prepares the dental arches for future rehabilitations, such as prostheses, implants, or bone grafts. The success of the treatment depends on proper periodontal evaluation, individualized planning, and patient education regarding objectives, timelines, and limitations, thus achieving significant improvements in aesthetics, function, and quality of life.